I'm Chris Eschbach, Director of Valencell's Biometrics Laboratory. We're going to talk a little bit about HRV today, heart rate variability, what it is, and what we might be able to do with it. First of all, we want to talk about where does HRV come from? And what we're really talking about are the milliseconds, the time between heartbeats. And if you understand heartbeats and you've ever been to your doctor and had your heart examined or known someone that has, they'll use an electrocardiogram. And that's measuring the electrical impulses of the heart. So let's talk about the electrical impulses of the heart just a bit. An electrocardiogram kind of looks like this. So every time that your heart beats, this electrical signal is produced. And when the chambers of your heart do their electrical impulses that cause the mechanical beating of your heart, this is measured by electrocardiogram. And the one thing that we're going to focus on this electrocardiogram is this R wave. So we end up with a couple heartbeats. And if every one of these are spaced out about 1 second apart, you can imagine then, of course, you have a heart rate of 60 beats per minute. But they're not always spaced out perfectly even. And that difference, that measurement between these heartbeats is called the R-R interval. And we measure that in milliseconds. And how that changes from beat to beat is really what we're trying to measure with heart rate variability. In optical techniques, a similar thing can be measured where we are measuring the blood flow within the vessels. And that's photoplasmography, of course. And this plasmograph, this blood flow measurement, we're measuring the peaks of that blood flow in the same way that we measure the R waves, and we call that PPI. So they're really interchangeable, the RR interval and the PP interval, measuring this in milliseconds. And of course, you can imagine that measuring the R waves is easier because they're very spiky, and the P waves is more difficult, and that's really what Valencell does best, is works with this photoplasmograph and determine where the peak is in that. So we measure this interval, and from now on we'll refer to it as PPI, although we're using RI and PPI interchangeably. So what happens? Why does this change over time? What makes it change over time?